Thank you very much for being here this afternoon. I'm joined by leaders of the Boston Public Health community, as well as the Boston City Council. I'll just introduce a few people that are here with us so you'll know. Rita Nieves, Interim Director of the Boston Public Health Commission. Dr. Jennifer Lowe, Medical Director at the Public Health Commission, who will speak in a few minutes. Marty Martinez, Chief of Health and Human Services. Jimmy Hooley, Chief of Boston EMS. Dr. Sophia Dyer from the Medical Director of the Boston EMS. We're also joined by City Councilor Liz Braden and City Councilor Nisra Sabi George, who's with us today. What we're going to do is just have a few words here, and then we'll open up for questions afterwards. We also have other members of the Boston Public Health Commission that are here with us today. But for the press, what we'll do is we'll go through a presentation, and then after that, we'll take questions. I want to just first express my deepest sympathies for anyone who's been impacted by the coronavirus throughout the world. It's a serious issue, and in Boston, we want to send love and support to the cities that are being hit the hardest, as we see on the news. As of right now, there are no confirmed cases in Boston. That being said, we are making sure that we take every single precaution to keep our city safe and healthy. Our public health agencies are trained to respond to infectious diseases. We are constantly assessing potential threats, and we'll be ready in the case of a virus does appear, so it doesn't spread. The Boston Public Health Commission and our Office of Health and Human Services are working extremely close together. The Boston Public Health Commission has set up an internal incident command system to help partners at state and local and federal levels to communicate and coordinate any efforts that are happening here in the Commonwealth. There will continue to be a resource for healthcare providers and as well as community partners. In this time, we're especially grateful to have the best hospitals in the world right here in the city of Boston. We are in the best position to respond if the virus does spread to the United States. Everyone has a role to play in keeping our communities healthy. I want to remind everyone that in the city of Boston to be smart and safe. We're in the heart of flu season. It's always important to exercise caution. And some of the things that people we take for granted or don't think of, we want people to constantly make sure they're washing their hands. Cover your mouth when you're coughing or sneezing. If you feel sick and it's something that affects you, the best bet's to stay home and take the day off and treat the common cold, just in case. We want to make sure we keep people safe. We also want to, same with schools, for our school-age children. If your kids are sick, we ask you not to necessarily send your kids to school because, again, it's spreading the cough, spreading the flu. Above all, check in on people who are more vulnerable. We want you to check on your neighbors. Oftentimes when we talk about this, it's during a snowstorm or some type of torrential weather issue that we might have, but we're asking you to kind of check on the neighbors, particularly older adults, any younger people that might live in and around the neighborhoods, and people with medical difficulties, anyone who might be disabled or you don't see them out much. We're asking people to check on them as well. Boston is certainly a city with a big heart, which means that we're always looking out for our neighbors and people in need, something that we take pride in. I want to, again, just thank the first responders and health professionals in our city. Every single day, all year long, they're working to prepare for any challenges that come their way. We thank them for their service to our city, for helping to keep Boston strong. And the main reason about today is to make sure that we get as much information out about the coronavirus. I know that in some cases, the news has been reporting it, and it's been worldwide, and it's been kind of a sensational story. And we want to just get some of the facts out here in the city of Boston to make sure people feel safe as moving forward. So without further ado, I'm going to hand it off to Dr. Jennifer Lowe, the Medical Director of the Boston Public Health Commission, who's going to say a few words. And then after Dr. Lowe, we're going to have Chief Hooley from Boston EMS say a few words.
Thank you, ma'am. Hi, thank you everyone for being here. First of all, I just want to reiterate what the mayor said. Right now, we have no confirmed cases of the 2019 novel coronavirus in the city of Boston, and the risk to the general public is low. And again, as I mentioned, BPHC, Boston Public Health Commission, is setting up an internal command, internal incident command, to ensure that we have the best coordination, collaboration, and communication across all of our partners. We've activated the BPHC Incident Command Plan plan to coordinate the response. Through this incident command, we'll track and compile all the latest information and reports from all the agencies regarding any concerns about the novel coronavirus, and we will serve as a resource for providers and partners by sharing these situation reports of the information that we collect within BPHC and with all of our partners. BPHC is coordinating response efforts with Boston's healthcare providers. We proactively train and exercise on scenarios like this on a regular basis, and we plan together on how to respond to these scenarios in case one does occur. There's ongoing communication between BPHC, our partners from CDC, the Massachusetts Department of Public Health, and Massport, which runs Logan Airport. BPHC is working with Logan on safety protocols for passengers and staff that go to the airport on a regular basis. The Commission is prepared to support any evaluation or treatment of suspected cases or significant contact to these cases. BPHC has also proactively been advising our key partners and collaborators. The Medical Intelligence Center and the Infectious Disease Bureau at BPHC distributed advisories to the public health and healthcare providers, to universities, and the public safety community. These advisories include best practices for clinical evaluation, diagnosis, and testing for this virus. BPHC's Infectious Disease Bureau also hosted an informational session for university health centers in the area. BPHC is working to keep the public informed by creating and disseminating educational materials, posting them on our website, sharing them with social media. All this information is available through 311 and the Mayor's Health Line. We have also been sharing it with our partners as well, and you can always reach out to 617-534-5611 with any questions. Again, I just want to reiterate what the Mayor said about the signs and symptoms of coronavirus. It's very similar to the flu, and we are in the heart of flu season. So fever, coughing, or shortness of breath, those are the symptoms that are described with relationship to coronavirus. Those are the same symptoms that you would have with the flu. So your best bet right now is to protect yourself against the flu and all viruses that we're subject to during this time of the year. Again, wash your hands, cover your mouth when you cough or sneeze, stay home if you're sick, and just take care of yourselves on a regular basis. I'm going to introduce Chief Hooley now. Thank you.
Thank you, Dr. Lowe. Thank you, Mayor. Good afternoon, everyone. So Boston EMS is in close coordination with city and state partners, including our public health, healthcare, and public safety partners. They're the first responders who could be called upon on 911 calls. We've learned so much from previous infectious diseases. We rely on the expertise of the CDC to guide us in our best practices. In the past, Boston EMS has successfully stood up heightened awareness, monitoring, and response postures for SARS, MERS, H1N1 flu, as well as some other emerging infectious diseases. We've taken the necessary steps to be prepared for a safe and effective response, and this includes having adequate personnel protective equipment for our crews and procedures to disinfect our equipment and ambulances so they can be safely back in the service so nobody has to worry about any kind of cross-contamination or infection. We have long-standing standardized infection control procedures that have served us well, and from all the research and the guidance, the procedures that we have, the disinfectant solutions that we use are adequate to cover this situation. We've implemented additional call screening during our 911 call taking process. If someone's describing fever, respiratory, or symptoms that could be suggestive of that, we've added in questioning specifically about travel history to Wuhan, respiratory illness, or fever. And if that is the case, we enter that and make sure we pass it on to the crews, and we would, be alerting the hospitals if we're taking anybody who we believe has to be placed into isolation. The men and women of Boston EMS are highly skilled clinicians. They've practiced, trained, and equipped for infectious disease prevention and control. And to beat the same drum as everybody else, again, we are in flu season. So if we do get calls for people with fever, respiratory, yes, it could be something new and novel, but it, more likely would be the flu that's among us. And but that doesn't mean we shouldn't worry. We still want people to take care of themselves. Isn't too late to get vaccinated for the flu. Flu itself kills I don't know what number of Americans every year, particularly people who are maybe older, have some other chronic diseases or immunocompromised, or some of the very young. So those are the people that would be at risk in any situation. So we want to make sure that we're taking good precautions there and exhibit good infection control ourselves. Our number one thing to protect our personnel is still hand washing, flu vaccine, and wiping down the interior of our equipment and truck after every single call so that we don't spread it among ourselves or the public. And so following those procedures at home will serve you well. If you have any questions and you have somebody at home who begins to feel ill, or there's a question of whether you should go to the doctor or maybe need a prescription for something, call your doctor, okay? If you have somebody who's in real distress, they're having difficulty breathing, the fever's really high, their mental status is getting a bit confused, call 911 and we'll be there and we'll take care of you. Thank you.
Any questions?
How often, down below, how often do you activate the incident command?
I'm actually going to refer that to, I don't know the last time.
Good, Chief.
Take that.
It's not as rare as one might think. We've done it during either certain potential outbreaks or back when people were talking about Ebola back around 2014 or whatever to be ready. It's more about to facilitate the sharing of information among departments, among hospitals, community health centers, because we want to see what are they seeing, what's South Coast seeing, what's Dimick seeing, so we ways to immediately share information. But we use it for big events all the time, like the marathon. We use it for 4th of July. We use it for First Night. We are really just sharing information on, hey, what are we seeing at the hospitals? It could be anything. It could be. It's used a lot more than you would think.
When was the last time it was used for illness?
For illness. I got to get back to you. Okay. Hey.
We can get back to you on that, too. All right. Any other questions?
You know, there was no confirmed cases in the city. Are there any suspected cases? Are you monitoring anyone? I know the flu is here, but are there any cases you're monitoring that might be controlled?
Yeah, so we are continually monitoring the situation. Our communicable disease control division has taken many calls. They continue to take calls and inquiries about this from our hospitals, health providers, and the general public. And at this point in time, there have been no inquiries that fit the criteria from the CDC that make us concerned about the coronavirus. The CDC is continuously updating their website as well, and we're working with them to keep abreast of any changes in screening protocols. But at this time, according to the criteria, we don't have any suspected cases that we're very concerned about.
Is there a study on this who said that the influenza really more of a risk to the public now than the coronavirus? Is that accurate to say that?
I mean, the flu is at risk, as Chief Hooley said, to those at-risk populations. And at this point in time in our community, it is much more common. You are much more likely to interact with a person who has the flu or is symptomatic for the flu.
You mentioned that you're working with Logan. Are they doing screenings, or do they plan to start doing screenings?
So at this point in time, Logan is not one of the 5 designated airports that conduct screenings. Any travel was previously redirected to one of those 5, and at this point in time, I am not aware that Logan is going to become one of those.
Is that because you're not seeing a lot of passengers coming from that region, or you could quantify how many people might be coming in from that region at time?
I am not able to quantify. I do not know.
Any questions that we don't have an answer to, if you can either call Massport directly, but our press team will try and get you the answer for that as well, just so you have the proper information.
What will the procedure be
So at this point in time, if you're in the city of Boston and you are concerned about a potential case, we ask you to reach out to the Boston Public Health Commission. We can share that phone number with you as well. If you are outside of Boston, you can reach out to Massachusetts Department of Public Health. You will talk to our public health staff, and they will discuss the criteria and see if you are at risk. If you are at risk, we will connect you with DPH and ensure that the patient is properly tested and specimens can be sent to CDC. So we really request that you go through us, because as we've discussed, a lot of these concerned people, they may have nothing to do with the novel coronavirus. So we really encourage you to reach out to BPHC or our partners at DPH and facilitate that testing process. And if we have any cases, then we will share that with the public when we have them.
I guess that's when are you going to talk with us? Like, if you send a sample to CDC, will the public know that it's gotten to that point? I mean,
We will share if there is a confirmed case. Yes.
So what I'm not hearing is that you're not saying to go to a hospital or to a medical office, right? That they reach out to you. Is that important?
Specifically around the testing and confirmation of novel coronavirus. I think Chief Hooley also mentioned that if you're sick and you're concerned, then you can reach out to your healthcare provider as you would for any other concern or condition. But if you have specific questions about the coronavirus, you can reach out to BPHC or DPH to clarify questions.
You mentioned that you have a lot of calls. Well, you mentioned that the symptoms are similar, like the signs are similar to the flu, and you have a lot of calls from people suspecting it's coronavirus, but they don't match up with the CDC prescription. How do you make that differentiation?
CDC put out very specific recommendations, which are you have been in Wuhan City in the last 14 days, or you have interacted with someone who is known to test positive for coronavirus and have symptoms of fever, coughing, shortness of breath. So a number of people call and say, I have the fever right now, and I was in Wuhan a month ago, or I was in China last week and I have a fever. Again, right now we are very strictly following those criteria, because a lot of people have flu symptoms and a lot of people travel to and from China. And so it would be difficult to not have those criteria that were set up and follow them.
If a person contracts the flu and the other person gets the corona, what's the difference in the prognosis for those two people?
So usually people with the flu virus are, the risk is highest for young children, young individuals, or older adults, or those with immunocompromised conditions. The coronavirus at this point in time, it has acted similarly. Some of the deaths that have occurred are in older individuals. So from what we know, there is a similar risk. However, it is a virus, and more information is becoming available. So at this point in time, I can say that they're similar, but we'll have more information as it comes from CDC.
how long does it take for symptoms to show up? Is there an asymptomatic period?
That information is not available at this time. There has been speculation that you can be asymptomatic and be a carrier, but we don't have a clear definition.
Last question.
How long is someone sick with coronavirus? Is it the same as the flu, a week, 10 days, or 2 weeks?
That is also under discussion. CDC has not put out any recommendations in terms of its infectious period.
Thank you. Mayor, do you have a question on the topic?
Yeah, one second. Sorry, yes. I think the bottom line is here is that we want to get out to the public. If you're sick, you have flu-like symptoms, contact your primary care physician. Let them know, because the flu is out there right now, and I think to get the proper treatment even for the flu is very important. And what we don't want to do is put fear in people across the city of Boston or in the country. But if you have flu-like symptoms and you're not sure, you're always best not to sit back and Google it and see, what is this? this, your best bet is to contact your primary care physician, because your doctor will know, or the nurse practitioner, somebody will know whether or not you should come in for treatment. And also, I don't know if it's too late to get flu shots, but flu shots are also really important. If you don't have a flu shot, it's helpful. We had a day here in City Hall a few months ago that hundreds of people got flu shots. So I would suggest, if you feel, some people just are against them, but I get a flu shot every year. I think it's important to get that shot as well. You have a topic, something else? Yeah. Yeah, horrible situation over the weekend. Young person, all young people involved, all juveniles. I can't get too much into the details. The commissioner is working on it, but certainly it's not the way. My heart goes out to families involved in the situation. A young person lost his life. It's just a really tough situation, and we're not sure the motives, what's going on here, but certainly anytime we see this, we make sure that our public safety office, our street worker program, our schools are paying a little attention to see what's going on, to make sure that, first of all, there's no kind of backlash from it, but number two, which is number one, is to reach out to these young people about how valuable life is. Tough situation, though, very sad situation. Yeah, I can't get too much into it. I don't believe it was gang-related, but again, the commissioner was still on investigation. They're working with I believe, the district attorney's office in trying to get the facts. And the fact that they're juveniles is very. We can talk to you and get more information to you later.
Okay, thanks.
Thanks, everybody. Thanks for covering this. Appreciate it.